Yeah, and I don't know like what you think about this, but I could see this definitely being a thing. They kind of say your health all starts within like your mouth and your teeth, and if you're not taking care of that, it will just deteriorate like everywhere else. Like it's all about your oral hygiene.
Yeah, I mean it's you're all connected.
Yeah.
So your heart, your mouth, everything.
Alrighty, everyone. Welcome back to another My Living Media podcast. I'm Lucy Dodd, and today we're with Samuel Holcroft with Holcroft Dentistry.
Hi, thanks for having me.
Samuel. We're so excited to have you here. If you could just start off with a brief introduction and tell us a little bit about who you are and what you do.
I'm Sam Holcroft. I'm a husband, a dad, 2 boys, son, brother, musician. But I guess for today, I'm a cosmetic and family dentist and excited to be here. Glad to be up in Stewart. I love coming up here.
Welcome. Well, tell us a little bit about yourself. Are you originally from Florida?
Not originally, but I've been here since 1986,
Okay.
85, 86. And so I've been here for quite a while. My wife was actually born here in West Palm Beach.
Oh, nice.
So she's an original. I'm not an original, but I've been here for a while.
Nice. How did you end up in Florida?
Family.
Okay.
Yeah, family kind of moved here. Grandparents were here, and so we kind of made our way over here from California, Oregon area.
Nice. Yeah, that's kind of same with me. I'm originally from West Virginia, and then my mom's sister was down here, and then we all just eventually migrated to Stewart, but I love it down here.
I've been skiing in West Virginia.
Oh, really? Where at?
Snowshoe.
Snowshoe. Yep, that's where all my friends and family go skiing. I love it there. So let's talk about how you got into dentistry. How did this all start for you, and what inspired you to pursue a career?
Well, at first I didn't know what I wanted to do. I was a science guy, and I was in school for science and education, and started teaching when I graduated, had an education degree, and kept going to school. So I went to Central Florida in Orlando. I went to Florida Atlantic in Boca.
Okay.
And by chance, I happened to run into a friend. His dad was a dentist. And, so I started asking some questions, and voila, ended up in dental school and becoming a dentist.
Wow. And where'd you go to dental school at?
I'm a proud Gator, so I went to University of Florida in Gainesville.
Awesome. And I saw on your website you were the #1 ranked graduating general dentist from University of Florida.
Yeah. So that was not easy. But I was very motivated, and dentistry is very detail oriented, and it was something where, well, first of all, I was paying for my own education, so I wanted to make sure that I made the most of it. So yeah, I'm kind of proud of that.
Yeah, I actually have a few friends. I have friends that are in dental school at WVU, and then I have one that's at a school in Virginia. And just like the work they have to do, it's crazy.
Yeah, it's not easy.
Oh my gosh, they always tell me they're always studying for tests, just the hours they have to put in. I don't know how they do it.
I was telling somebody one time, my sophomore year in dental school, at one point in time, they stagger the classes. At one point in time, I think I had 15 classes going on at the same time. So, and people that are in college normally take, maybe 4, 5, 6 classes.
Yeah, I can't imagine. Yeah, I was a communications major. I can't imagine even going and doing more after just that, because that was even a lot.
Yeah.
So what inspired you to open your own practice?
I wanted to be a medical provider, and help people. And also, I guess, a business person. And owning a dental office is basically a small business. And being my own boss is nice. And being able to not just work on patients, but, being able to come and do podcasts and things like that and discuss business.
Yeah, that's awesome. And what do you think sets Holcroft Dentistry apart from other dental practices in the local area?
I think one of the biggest things, because, again, you're seeing a big change in dentistry, one of the biggest things is that we are not a corporate chain. We are not owned by shareholders. I'm the boss.
Yeah.
And it's a family feel, and we have patients that come and refer us because they just enjoy coming. They drop off cookies, things like that. We have patient barbecues, things like that for, patient appreciation. And yeah.
Yeah, I think having that family feel, that locally owned aspect is really important for people, just because like my whole life, I've always gone to like local family owned practices. And I think it makes such a difference. Like I feel like just going to, my childhood dentist all my life and then transferring over to, I don't know, I guess it'd be like my adult dentist. I don't know what the right term is for that, but I just feel so comfortable. They feel like family. Like it's a great experience.
There's a big difference, whether it's how the phones get answered and whether you're getting routed to 5 different people that don't know an answer, to, a dentist that, is referring somebody just because, they don't have the knowledge, they're right out of school and have never seen something before. So there's a lot of differences that, with our office compared to many other offices.
Yeah, I'll never forget when I had to get a root canal once, and that was like terrifying for me because I used to be terrified of the dentist. It's obviously gotten better as I've gotten older, but I went to like a local family owned, would he be like an orthopedic surgeon maybe? I don't know.
Endodontist.
Or endodontist, yeah, that makes more sense. Yeah. But it was locally family owned, and the whole process I was terrified going in there, and they made it so easy. I walked out, I was like, that was a piece of cake.
Yeah.
So that definitely does help make a difference.
Hopefully your tooth's better.
Yes, it's a lot better. Could you describe the range of treatments that you guys offer?
Sure. Well, you just mentioned root canal. We, both myself and my doctor associate, Nick Perez, between both of us, we do all kinds of procedures, pretty much everything from surgery to clear braces to preventative treatment. We have 3 wonderful dental hygienists that do cleanings in the office that have a ton of experience. And if there happens to be something that is a little out of our realm, then we have a wonderful network of specialists that we can refer to that I've known because of my, time in the area. I've been here over 20 years in the area. And so I would like to say that I know who's good and who might be questionable on who I, want to refer to.
Yeah, that's great that your patients have that, because I feel like with any referrals in any industry, it is nice to know that you're getting a trusted referral as a patient.
Yeah, and the big word nowadays is cosmetic. You hear cosmetic all the time. Well, yeah, of course you want it to be cosmetic. No one wants to have a big turtle tooth.
Yeah.
But yes, we do cosmetic treatment. We do veneers. We do orthodontics, all of that stuff. But at the end of the day, also we're a general dental office. And so if you need a root canal, or if you need an implant or a bone graft, or you have gum disease, we can treat that.
Awesome. So you guys do it all. That's great. So I saw on your website there's something called digital dentistry. So what technologies are these, and how do you incorporate them into your practice?
Well, there's so much advancement in dentistry, and I don't want to you sit here and talk for a long time, but a couple examples: digital X-rays, where you don't have to dip the films into the chemicals. They're taken and put up on the computer immediately, and you can and they're very, very diagnostic. We have 8 treatment rooms in our office, so we have multiple computers in each room.
Yeah.
And digital X-ray sensors. They shoot up onto the computer, and you can enlarge them. You can enhance them. Another neat thing that patients find interesting is a digital scanner. So if somebody, let's say needs a porcelain crown or cap, to cover their tooth, you can actually scan it with a little wand, goes to the ceramist, makes the crown, and so they find that pretty interesting, and they don't have to bite into the big mouthful of gooey stuff like you used to have to do. We can still do that, but we do scan a lot of stuff, and your braces. People that have orthodontic work, like Invisalign or Sure Smile, things like that, you just scan their mouth, send it off, And then we can go through that on a computer, start to finish. Hey, this is what we're anticipating, what you'll look like in 10 months. And which is pretty amazing, because back in the old days when you had orthodontics, people would be wearing braces for 2-3 years. And so a lot of the technology will allow you to do that in about 10 months.
Yeah, I actually went, because we were talking earlier about how I had Invisalign in high school. Of course, I was really awful and didn't wear my retainers. So not too long ago, I went and got a consultation to get them back. And they used one of like the scanning machines, and I was amazed because it's like I could see my whole mouth, like 3D. I was like, whoa. It was just mind-blowing. Yeah. It's also kind of a little scary to see, because I was just like, wow, that's literally what my mouth looks like. But it was really neat. And they're like, we can see, like we can project what, this treatment will look like.
And all of our rooms have intraoral cameras too. And it's sometimes nice to be able to show a patient on the computer monitor right in front of them, let's say a crack on a tooth. And you can go ahead and say, hey, you need to have this fixed, and they can visually, see that. Or for an insurance company, nice. Who we love to work with, and so you can send that and say, hey, here's a tooth with a problem. Please help your customer out and pay their claim.
Yeah, that's nice. So, how do you guys help with people who have major dental anxiety? Like, how do you walk them through and make sure that they feel completely comfortable? Because I'm someone who dealt with that. I feel like I had a few bad experiences as a child that kind of led into early adulthood. Now that I'm getting over it. But how do you work with people like that?
I think there's a couple things. First of all, the environment. I'm sitting in your office right now, and it's so comfortable and relaxing. And so when you walk into a dental office and people are running around all over the place, and one person's yelling at another person, and I need, that's high stress. And so, the people that you have working for you, the environment that you present makes a big difference from the front door and till going to the back office. And of course, there's things that you can do chairside, nitrous oxide, oral sedation, some of these things that will calm a patient. But a big thing is just the environment. I just had a person yesterday, a new patient that, I wouldn't say a kid, but because he's in his 30s, but he has Asperger's syndrome. He's like a, autism type of scenario. And you can't rush that type of person, because you have to make them feel comfortable. Yeah. It's a new environment, and a traditional, let's say, again, I go back to a corporate setting, those people, for financial reasons, you have 30 minutes to do a cleaning. Yeah. Okay. You're in, you're out. Someone else is cleaning the room, in, out, next person. You can't do that with everybody. Yeah. That's not comfortable. Some people might find it okay, but in this situation, that's not comfortable. And I could come in and sit down in the hygiene room where he's getting his teeth cleaned and talk to him and ask him questions. We talked about video games and things, and how my son loves video games, and try to make him comfortable so that we can then go through, and, he had quite a few dental needs that we can then slowly start to try to help him out.
Yeah, that's nice, because I feel like some people, it is a whole, situation of them just needing to like have a slow process, maybe understand it a little more. Because I'll never forget, up in West Virginia, I had a great family dentist. And then we moved down here. Obviously, we were trying to find someone in the Stewart area. And I had this one dentist, and he literally made me cry. He just made me feel so ashamed for like what was going on in my mouth. And I was scarred, and I was like, I never want to go see someone again, because like it was such a bad experience. And then luckily we found like a family friend, and, from there.
People think a dental office is just about teeth, just a big mouth sitting in the chair, but it's about relationships, and sometimes, I'll sit there and I'll be talking to a patient in the chair doing their cleaning check, looking at their teeth. I start talking, and, and my hygienist will have to kind of kick me out, because, we start talking about their last trip, or their kids that have graduated who, I remember seeing them when they were 6 years old. So, that to me is also a big part of dentistry. Yeah. It's not just about a tooth.
Yeah, that's a great message. I feel like that's definitely very important to people. So how does your practice contribute to the local community or engage in outreach programs?
Well, again, going back to not just being about a tooth, we're a part of our community. People within our community come to see us for services, and we help them with dental needs. But we also give back. We're involved with different organizations, LLS, which is the Leukemia and Lymphoma Society, blood cancer group. Last year, I think we raised over $7,000.
Oh, wow.
For them. Earlier this year, we also had an event for the pediatric oncology team, and I was able to give them a check for $1,400 or $1,500. I thought that was pretty cool.
Yeah, that's awesome.
We do high school scholarships, my old high school, go Manta Rays. And so we give a senior who's going into the healthcare field a scholarship. We do smaller little, donations. So, we do a food bank in West Palm. So we always try to give back, and not to bore everyone about how I run my business, but, I have separate financial buckets at the bank, like payroll, taxes, things like that.
Yeah.
And one of those buckets is a charity bucket.
That's great. And that's another great thing about our locally owned practices, businesses. I feel like everyone in our little communities, they're just so giving. Like a business like yours, like you guys are just so giving, and it's a great thing to see.
Yeah.
So in your opinion, what are some common misconceptions people have about dental health, and how do you address them?
There's a couple things that drive me nuts. One of them is, it doesn't hurt, so I'll call you when it does, and we can deal with it. And so, for example, when I talked to you about a picture of a big cracked tooth.
Yeah.
But it doesn't hurt, but it needs to have a certain type of procedure, let's say a crown or something like that. And what ends up happening is that crack can then get worse, and now all of a sudden the tooth needs something like a root canal.
That was me, actually.
or even worse, that crack goes down onto the root, and now you can't fix it, and now you have to pull it, and either you don't have a tooth or you do a bone graft and an implant.
Yeah.
So things get worse with teeth and with dentistry, with gums, and so that's the first thing. And the second thing is that, my teeth are bad because of genetics. My mom and dad had bad teeth. It's genetics. And I will stand up here and put my hand up and say, I respectfully hear you, but that is totally wrong. My dad had all his teeth taken out in a denture.
Yeah.
And I can tell you right now, I have all my teeth.
Yeah.
And it's just that I take better care of them. And went to the dentist more when I was young. My mom took us to the dentist.
Yeah.
My dad never went. So that's the second thing.
Yeah, going back to your first one, that's how I actually ended up getting a root canal. I was actually on my way back up my sophomore year. I was eating a Snickers bar, and somehow I cracked a back tooth on like the peanut. And I was like, oh, well, it doesn't hurt. I'm like, and I didn't have like a dentist up in Tallahassee. I only wanted to go to my local family dentist in Stewart. So I was like, I'll worry about it when I get back home for break. Turned into I needed a root canal because the problem got like 10 times worse.
And you know what the biggest thing is? The biggest thing is when you have to tell somebody that they need some scaling and root planing, which is like a fancy word for deep cleaning. Because, when they look and smile, they may not notice anything, but when you look on an x-ray or you do some measurements, there is no bone holding this tooth. And, it's just ready to just kind of fall out. And they say, well, nothing bothers me, and because I don't feel anything. And sure enough, 10 years later, they're wondering why they have false teeth. So again, some of these, and that becomes a trust issue. You have to educate and hopefully form a bond so that the patient trusts you. Yeah. And that you educate them properly so that they will then follow through with treatment that will help them.
Yeah, and I don't know like what you think about this, but I could see this definitely being a thing. They kind of say your health all starts within like your mouth and your teeth, and if you're not taking care of that, it will just deteriorate like everywhere else. Like it's all about your oral hygiene.
Yeah, I mean it's you're all connected.
Yeah.
So your heart, your mouth, everything.
So what advice or tips would you give to our audience on maintaining good oral hygiene or overall dental health?
All right, you want an easy answer? Do as much as possible. You know, the more you take care of them, you know, the happier they'll be for you. And that's both home care and dental visits, you know, water picks, flossing. I tell you right now, no one likes a floss, but you know what? It floss the ones you want to keep.
Yeah.
And then going regularly to the dentist. I can tell you right now that someone that goes to the dentist on a regular basis is going to be that person that I hardly ever have to do any work on.
Yeah.
I'll just tell you right now. And when I do a humongous dental treatment plan and have to do something for a patient and they stand back and say, oh my gosh, what's that going to cost, or this or that? Well, guess what? Those are the people most of the time that it's been 5 or 10 years since they've been to the dentist.
Gosh. Yeah, see, I get too paranoid. I'm like too OCD where I'm like, I need to go. So how many teeth cleanings should people be getting on a yearly basis? Is there like a certain amount that's recommended?
Most people come, you know, twice a year.
Okay.
You know why? No, because insurance companies have such a hold with our society in general. And that was the generic number that they threw out there. They'll say, well, we'll pay for mostly 2 times a year. And that just sort of became the norm. Wow. And for a lot of people, that's fine. Yeah. And there's a lot of people that come more often because of gum disease that we mentioned before.
Yeah. And
then there's some people that come more often because they just want to take care of their teeth. They just sit in the chair and the hygienist does everything for them. And so the more you take care of your teeth at home and going to the dentist, the less you'll have to see me in my doctor chair.
Yeah. So what about teeth whitening? That's something I always do, like the at-home teeth, like the little strips. But I always find like after my teeth are so sensitive. So I don't know if I'm like, there's something, maybe it's like I don't know. Is that not good for my teeth or?
No, I mean, normally everyone's teeth are different.
Yeah.
So some people have just generally sensitive teeth, or let's say that their gums have shrunk back a little, so a little bit of the roots are showing, and so sometimes those people might have a little extra sensitivity. Those are the people you tend to see that the commercials for Sensodyne toothpaste and things are trying to, you know, capture. But can you overdo it? Sure. You know, I've seen teeth that are almost a bluish shade because they just bleach so much. I said, you need to kind of cut back on this. But for the most part, it's not a dangerous process, and I have nothing bad to say, whether it's strips or whether it's bleach gel that you get at a dental office. But again, you know, you have to be wise. You can overdo anything in life.
Okay, that's good to know, because I always sometimes like it will come and go. There will be certain times where it's like my teeth are sensitive after. I was like, I just wasn't sure if that was a bad thing or not. But
Lucy, you're a sensitive person.
Yeah.
That's all it is.
So what is one last thing you want our audience to take from this podcast?
Dentists are here to help you. And if you go and take care of your teeth, they will take care of you. And, you know, if there's something that I said today that helped to inform a person about, you know, taking care of their teeth or finding the proper place, you know, to go and where they feel comfortable and what to look for, then this was a successful meeting and discussion that we had. Because again, not every dental office out there, not every dentist is a good dentist. I hate to say it, for whatever reasons. And so just kind of keep that in mind.
That's a great message. So one last thing, where can our audience learn more about Holcroft Dentistry, or how can maybe they get in touch with any questions they may have?
Well, first of all, our office phone number is 561-622-5600. I always tell people to check out our website. You can actually get to see me up there running on a video screen, and it shows a little bit of the office. It tells you a little bit about our office. And so that's www.pbgdentist.com. And you should always do your due diligence. Don't just trust me because I'm talking to you right now. You know, do your due diligence. Look online. look at a website, look at reviews, look what people say about an office. Every single business will always have that person that gives you a 1 or a 0 because they're just having a bad day. But if you look at the big picture and you see all these 4s and 5s for a pizza chain or a dental office, then that probably means something. So, but I get sidetracked easily. But anyway, check us out. And if you like us, then please come visit us.
Alrighty. Well, that's a wrap. Thank you so much for joining us, Samuel.
Thanks, Lucy.
And we'll see you guys in the next episode.
Thank you.